Hello, welcome to this live Q&A hosted by the Cleft, Lip and Palate Association on the subject of hearing, funded by the National Lottery Community Fund. Before we start, I'd like to welcome Julie Humphreys, a British Sign Language interpreter, along to our session, who'll be providing BSL sign of the conversations taking place this evening. Thank you so much for being with us tonight, Julie. My name is Jen. I've been volunteering for about 4.5 years. I have a 5-year-old daughter who was born with a bilateral cleft lip and palate, and although initially her hearing was within the normal range, when she was about 18 months old she was diagnosed with glue ear and was found to have a moderate hearing loss in both ears. So she has originally wore a Baha hearing aid and now wears the in-ear hearing aids. So today I'm joined by Lisa, our other CLAPA volunteer, so I'll hand over to Lisa for her to introduce herself.
Hello, my name's Lisa and I have a cleft lip and palate. I'm severely deaf in one ear and profoundly deaf in the other. I wear 2 hearing aids and I'm just being assessed for a cochlear implant. Going through that process. I have a daughter that's got cleft lip and palate who's 23. And she's got early ear hearing loss and wears hearing aids as well. And I've been volunteering for CLAPA for about 20 years on and off. So today's session is all about hearing, how it can be affected by being born with a cleft, the treatment options available, and how to manage hearing loss related challenges in everyday life. We're very pleased to welcome cleft specialist audiologists Colette Halls and Ralph Chorbachi, cleft specialist speech and language therapy Amy Darters, and a volunteer from the Royal National Institute for Deaf People, Brent Stanbridge. Colette, Ralph, Amy and Brent, do you want to introduce yourselves?
Hi, I'm Colette Halls. I'm the cleft audiologist for Broomfield Hospital in Chelmsford, which is part of the North Thames cleft team.
Hi, I'm Ralph Chorbachi. I'm the audiological physician in the cleft team, and my special interest is in children's hearing and cleft lip and palate.
Hello, I'm Brent. I volunteer for the RNID and have done so for about 5 years. I've been progressively deaf since Middle Ages, so about 40 years, and been wearing hearing aids for over 30 years. I had ENT problems as a child, including something they called then fluid on the inner ear, which I think we now know as glue ear. But I still had problems with my eustachian tubes, and I'm now progressively profoundly deaf, and look forward to getting a cochlear implant later this year.
And I'm Amy Darters. I'm a speech and language therapist, currently working in the cleft lip and palate team at Great Ormond Street Hospital in London. Prior to that, I worked at Adam Brooks actually in the cochlear implant and hearing implant team there. So complex speech and cleft and hearing loss have been 2 of my passions of my career. Nice to be here today.
So thank you so much for joining us this evening. Thank you as well to everyone who submitted a question in advance. If you have a question or comment whilst you're watching this live stream, please pop it into the comments and someone from CLAPA will either respond directly to you or pass it on to us. Okay, so we'll move on to the questions. So Lisa and I are going to take it in turns to ask the questions, and our panel of experts will provide the answers, hopefully. So to start with, the first pre-submitted question we have is, how many babies with a cleft lip and palate are affected by hearing loss?
I've got a little bit of stats on this actually, because I'm doing a research project at the moment which is looking at the effect of cleft surgery on hearing. So I've been gathering data for sort of over the last sort of year and a half, 2 years. So I've only got a small amount of sort of data on it. But so far, what I found is at the screening point, so at birth, with the results that I've got, is about 26% of babies will have a hearing loss, which is in the main, I would say probably glue ear, but there are a couple of sensory neural hearing losses in there. 7 to 9 months pre-op sort of test is around about 69%, so it does go up. At 3 months post-op, it's around about 50%, so it's gone down a little bit. And then there's a sort of a different sort of chart that shows that around about age 5, so about 30% of children will have a hearing loss. And I think that's one that you're aware of, Ralph, from a previous talk that you did. So I'll hand over to you actually for the next bit.
Fair enough, thank you. Absolutely, very informative levels. But what I'd probably say, first of all, we need to look at it as in what is the level of hearing loss here in question, and the as Colette said, the type. So at the age, if we go right to the age of 5, approximately, again, as Colette was saying, 30% will have a hearing problem. However, when we look at the results, it depends on whether we're looking at both ears or one ear. But generally speaking, it's approximately 30%. So 70% would have at least good hearing in one ear. I know that's technically and functionally is not very not the right thing, but if we as an answer, this is where it is. And then if we go around the age of 10 years, the figures even get better. So approximately 5 to 10% will have hearing issues. And after that, we'd really expect the hearing to normalize. So by the age of, after 12 or 15, we'd expect things to be normal. Now, again, I would put a proviso and a caveat that this is based on the threshold, the tests which takes place in the clinic. So in the environment where there is noise and competing sounds, it can be a different story, and each case is on its own merit.
So my son has mild to moderate hearing loss. We've been told by that the main issue is glue ear, but that this can resolve itself by the time he's 12. Can you explain what happens between the age of 2 and 12 to give us an idea of the changes and when we should consider grommets?
Yes. Okay. So what tends to happen is mainly we'd expect the palate repair, especially the well, I won't call it new technique, but the current good practice technique, which is repairing the muscles of the palate, and they would help in speech as well as significantly in the hearing, improving the Eustachian tube function. We'd expect things to normalize, as you've seen from those figures. And then it all depends on, there are other factors, competing factors on the function of that tube. What we know is the Eustachian tube. It's a tube which ventilates the middle ear and links it to the back of the throat, what we call the nasopharynx. And there are other factors. So there are factors such as inflammation, infections, allergies, smoking in the household. All of these factors can affect the function of that tube, as well as the adenoids. But the adenoids, which are a lymph tissue which enlarges, that is really important that specialist advice is sought at the cleft center prior to planning any intervention, because it has a specific relationship as well with the speech, and I think Amy would come and give us some of that as well, some information on that. So yeah, so I think we would expect things to improve because the stake-in tube caliber also improves, as well as the repair of the palate and the muscles, and the adenoids tend to shrink. So we'd expect things to improve going on, longitudinally as the child grows.
Great. And yeah, just touching on the adenoid tissue and the role of it in speech. So for many of you will know, I'm sure, but for those who don't, we have a hard palate, which has bone, and a soft palate, which is made of muscle. So if you put your tongue on the roof of your mouth, you'll feel that it's hard and bony. That's the hard palate. And if you then take your tongue backwards, you'll feel it suddenly go soft. The soft palate is soft because it's made of muscle. And we don't realise it, but during speech, that soft palate muscle lifts up and lowers down and enables us to create lots of the sounds in speech so that our speech is clear. And so what's interesting about the adenoid tissue is that it sits behind the point at which the soft palate touches the back wall of the throat. A little bit technical, if anyone wants to YouTube Simone speech graphics, that helps because it shows a moving diagram of how the palate works in speech, the soft palate specifically. But what we know is that when the adenoid pad, that pad of lymphatic tissue, which Ralph referred to, when it's big, it helps with the palate closing against the back wall of the throat. As children get bigger and older, that shrinks back, and that can sometimes change things. So that's what the adenoid pad is, and that's why it helps with speech. But yeah, clearly it also has a role in hearing, and all back there you've got quite a small area of the throat and the nasopharynx that's behind where the soft palate closes, and back there you've got the eustachian tubes, you've got the adenoids, you've got lots of structures of the soft palate and back wall of the throat that are all in quite close proximity. So it's worth looking into, but certainly your child's ENT specialists will be talking to you more about the adenoids and the tonsils if they're a problem. If they're not a problem, and if your child is not having any problems with ENT, ears, nose and throat, then that's fine. But if they're seeing an audiologist and there's some hearing difficulties, it might well be that you're under ENT, the ear, nose and throat specialists as well, and they'll advise you all about the adenoids if they're relevant to your child's care.
Brilliant, thank you. So the next question is, how can I do hearing tests on my own child in between the 6-month checks? What are the signs to look out for?
Right, it's quite difficult to do a hearing test on your own child, sadly, depending on their age. I think probably if they're a little bit older, I believe that the RNID do have a sort of like a hearing test thing that you can do for sort of adults. So that might be something of an older child, if you wanted to sort of see what their hearing was like. On their website, they've got sort of like a little hearing test that you can do. But sort of generally the things to look out for is if you're having to repeat yourself, if your child's withdrawn, the television's going up, you're shouting more, they're struggling to focus in class, those sorts of things would be things to look out for. But yeah, sort of actually the hearing, doing a hearing test itself would be sort of quite tricky, but those are the things you'd look out for. Also, there was a checklist, a newborn hearing screen checklist, on the government website is quite good, because that will show you what to expect the sort of milestones to expect your child to get to at certain ages. So that's quite useful as well.
So we have been given the choice between grommets and hearing aids, and we're struggling to make a decision. What should we consider?
That's a very good question. Now, generally speaking, the practice currently, and as much evidence suggests that, number one, the palate repair, so the surgery for the soft palate and repairing the muscles of the palate, that will improve the function of the stake and tube, and therefore there is no need at that stage, and to give that repair a chance to work and improve the stake and tube, there is no need to do any invasive interventions such as grommets. So the current practice is that hearing aids, if needed, if there is a hearing issue, is the first line to start with, and then to monitor the hearing and see whether that improvement has occurred after the repair. If not, then at that stage, there would be a joint discussion with the audiologist, the parents, and the ENT surgeon to see whether there is any added value from the grommets, because both interventions have their advantages and disadvantages, and it's a risk-benefit type of balance and discussion. At that stage, especially if there is any concern about the health of the middle ear, so by that I mean if potentially the audiologist or the physician or the ENT surgeon thinks that there might be long-term effects of the glue sitting there within the middle ear, then at that stage, a grommet might be needed. Now, again, I would say that there's no hard evidence that grommets would help in preventing the long-term complications, and neither the reverse is true. Again, we don't know whether or not intervening will help that. However, in general, few years back, before the introduction of the muscle repair of the palate, we used to find that there's lots of scarring from grommets, repeated grommets. So some children would have 3, 4, 5 sets before the age of 5. And that wasn't helping their eardrums at all. And at that stage, everyone paused and thought there might be a better way to answer this dilemma, this issue. So at the moment, the summary is hearing aids as first line, and let the palate repair help to improve the stake and tube function. And then later on, if need be, grommets with a multidisciplinary discussion.
Thank you. The next question is, will my son's speech improve if he gets grommets?
Okay, I guess it follows on to the the one before. So grommet is similar to a hearing aid. It's it's an intervention to improve the hearing. So if the speech is directly related to the hearing, then in that particular case, one would say yes. However, in my experience, it's definitely much more complex than that. Speech and hearing not always they are directly linked, but the cause effect, you not immediately you'd improve one, you get the other. So I would say in the short term it may help, but don't forget that grommets are really short-term solution, and one would need to think of other modalities to improve the hearing. So the aim is to improve the hearing and not just focus on the intervention of the grommet, the particular type of intervention. I don't know whether Amy, do you have any suggestions or?
Yeah, absolutely. No, I agree with what you've said, and it's certainly a complex relationship. So we know that speech and hearing, as you say, are intrinsically linked with each other, but it is complex. And so for some children, parents say, oh, they had their grommets and suddenly their speech came on leaps and bounds. Other parents, they have their grommets and actually that doesn't happen, or it does happen, but it takes a much longer period of time. And so I think there is always an argument for looking at the audiogram. And Ralph, I don't know if you've got the speech banana there for me, or Colette, thank you. But if you're looking at an audiogram for your child, and you know that certain aspects, certain frequencies, thank you both, are missing from their audiogram. So either they have a hearing loss in the low frequencies, but the rest are fine, or conversely, a hearing loss in the high frequencies, but the low frequencies are fine. That sometimes has an impact as to which sounds we expect to be affected. So if your child has a low frequency loss, we might expect the vowel sounds and some of the lower frequency sounds to be affected. Sometimes we assess a child's speech and they often have vowel distortion. And we would say, interesting, because they've also got a history of conductive hearing loss. And so maybe those two things are linked. Conversely, some of the high frequency sounds like s and sh, sometimes those are the ones that are distorted or that are different. And we might think, when we look at their audiogram, it's those sounds that they're missing in terms of their perception of sound. So for some children, there is this intrinsic link between what we're hearing in their speech and what we're seeing on their audiogram. And for those children, often, yes, when they have their grommets, it helps with their speech because suddenly they're able to perceive sounds that they weren't able to perceive before. Conversely, as Ralph says, sometimes it's much more complicated. And so we have these high expectations, and then actually that's not so much the case. And I think we also have to bear in mind the fact that it's not just about speech and speech sounds, it's also about a child's language development. And language is all to do with understanding of other people's words and sentences, but it's also the child's use of words and sentences in addition to their speech sounds, which is kind of how we pronounce things. That's like the cherry on top for us. If a child is saying cat instead of tat, we are very excited about it, but the speech sounds are the cherry on top. So it's a complex answer because it's a complex relationship. So I would caution parents against pinning their hopes, as it were, on the grommets, because sometimes it works a charm within weeks. Other times it takes 6 months, takes a year, could take longer for a child to update their understanding of the sounds in words and therefore make an improvement in their speech. But there's no doubt about it that if a child has better hearing, then their speech is intrinsically linked. So yeah, we would always be shooting for a child to have as good an access to sound as possible to aid their speech development, speech and language development as much as possible. I hope that makes sense.
My son is 10 months old. He's got a cleft palate. He's had 2 hearing tests so far showing mid and high frequency issues, but we don't have an appointment until October to discuss what can be done. What can I be doing to support his language development, as worried he's missing key things at his age?
Well, I start off on this one. So language development is a really key aspect of communication. So as I said in the last answer, language is all about words and sentences. So it's about understanding of words and use of vocabulary, so single words, but also how we put those together. So mummy go shop, for example, would be an example of a short phrase that a child might use. In terms of supporting his language development, the key thing to do is to talk to him as much as possible. Lisa, did you say he's 5 years old?
10 months old.
10 months old, so sorry. Okay, so he's 10 months old, so he's very little at the moment. But even at that young age, you can narrate things that he's doing and playing with. So what we know is that repetition is the absolute key in helping children to start recognising and understanding words. So for example, if he's playing with a ball, repeat that word ball over and over and over again. So you can say, it's a big ball, it's a bouncy ball, oh, you've got a blue ball. Whatever you want to say about that ball, say that word ball over and over and over again in as natural a way as you can. The reason for saying that is that it's only by that repetition that children start to link the word with the concept. So the word that you're saying, ball, 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 with the object that's in front of them, which is the ball. So all I would say is talk to them as much as possible, name the items and the toys that they're coming across, narrate what they're doing. So if they're eating, you can say, oh, you're eating your dinner. Your dinner, it's lovely. Isn't it tasty, your dinner? Whichever word you're trying to teach them, say it, don't be afraid of repetition. That's the language and vocabulary bit. In terms of speech sounds, what I often say is hold things up to your mouth. So let's use the example of ball again. If your child has a ball, when they start playing with it, you could hold it up to your mouth and just say, ball, it's a ball. So that not only are they having that input of the sound, hopefully as much as possible, but they're also seeing your lip pattern. And so both modalities, both vision and hearing, they're seeing and hearing as much information about the speech sounds that you're making in the words as possible. So sometimes I recommend to parents that sound bag, so they might walk around the house. They might be focusing on p, for example, and they can find a pear from the fruit bowl. They can find their child's pajamas. If they're focusing on bubbles, ball, bus, whatever they can find around the house, that begins ideally with p and b if they're thinking about speech sounds, because they're really clear on your lips. So you can pull things out, help the child explore. When they're 10 months old, they might be excited by the bubbles. Lots of children love bubbles. So you can blow some bubbles and do some popping. But whenever you bring things out of a bag, I always recommend holding it as close to your mouth as possible, because your child's attention and their excitement will be on the object. So if you say, oh, what's in my bag? And you can behave as excited as you can be, because the more excited you are as the adult, the more excited they'll be as well. And you can bring things out and you can say, oh, it's a pear. And just holding it there means that your child's eye gaze and their attention will be on the object. But if it's close to your lips, then they're getting lots of information about how you're making those sounds as well, and information about the words. So that there are a few top tips as to a few things that you can do to support your child with their speech and their language development, even if they've got some hearing loss at the moment.
Thank you. The next question. My 3-year-old has been born with bilateral cleft palate. He's been affected by gluea, probably in both ears. We've been told by one audiologist to use grommets to help the mucus to leave the ear, and the other audiologist has told us not to do any invasive operations. What should we do? Which advice to follow? We've kind of perhaps already touched on this, but I don't know, one of the previous questions, but I don't know if anybody wants to add anything extra.
No, again, just to reiterate, it's a team discussion between the parent, the audiologist, and the ENT surgeon. And the important thing is to give that repair a chance to work. And only if potentially there are concerns about chronic middle ear disease and it's felt the grommet may help, then at that stage, intervention, it may be warranted, but even some merit, just to reiterate. Yeah,
I think you do find that quite often, that everyone has their own personal view as well. So you'll get one audiologist, yeah, grommets are brilliant, one audiologist, hearing aids are brilliant, and that sort of happens everywhere. So it does make it really difficult to, if you're faced with that decision, to sort of think, oh, what should I do? Because you're getting sort of conflicting opinions from everybody, unfortunately. So it does make it quite hard, I think.
My hearing has been affected by a cleft palate, and I'd like to know how to go about getting to see an ENT audiologist cleft specialist and how I find a cleft team, please. I
would suggest that the first route, the best route would be to go for your GP. They will be able to, if you go to them and say you've got problems with your hearing, they should be able to refer you to an ear, nose and throat specialist. I think there is unfortunately quite a long wait on ENT at the moment, so it may not be sort of very quick, but that is definitely the route that I would recommend, is going for your GP.
Yeah, and again, probably what I'd say, I mean, most of us are, you could say you can find out some additional information, whether through the website, say, of any charities and patients organizations, and try and get information to find out where is the specialist with that particular interest, and ask the GP to send you there. I mean, there is they may say, oh, it's outside of area and what have you, or maybe there's waiting lists, but do keep in mind that it is sometimes better to do a little bit of research and find, let's say, an otologist, because some ENT surgeons might be specialized in, let's say, airways. Their main specialism is airways. Obviously, they can do most of the ear work, but you have a subgroup of ENT surgeons who specifically can do more of the ENT, the ear work. So again, you can ask your GP that you'd want with more specific interest if it is, you know, a surgical intervention. But again, audiologists are really good and expert in their intervention, so it might be a port of call to help with the hearing until you reach that stage of the intervention, if need be.
If it's children, you can often get a referral to audiology through your GP. If it's adults, then it's, if you're over the age of 50 normally, that you can get a direct referral to the audiology department. So in that in between children and age of 50, it generally sort of does unfortunately tend to be ear, nose and throat, which is good, ear, nose and throat, but it can be a little longer wait than audiology. But the children, and you can get direct referral through to audiology departments normally. I can only speak for my area for definite, but I think generally it tends to be that way throughout the country, that it's sort of over 50 and children can go usually through audiology think.
I think the question also asked about finding a cleft team more generally, and I believe there's a map actually on the CLAPA website, correct me if I'm wrong, but of all the cleft teams in the UK. Colette, there you go. So I think that's quite helpful as well, so that when you go to your GP, if you're hoping to be referred to a cleft team, if you can say, oh, there's a cleft team here, I have a history of cleft, I'd really like to be referred, it gives the GP a little bit more information about what you're asking of them. And for paediatrics, I know there's often audiologists on the team. Often there's audiologists in the team, even at other cleft centres around the UK as well. So that might be a good port of call for them. If they've got a cleft in any case, get referred to the cleft team, and you may well find the right audiology bod on that team.
I think on the CLAPA website, I think there are email addresses as well, so you can directly contact the cleft team, or your local cleft team. So they would be able to give you advice on sort of what you should do and what their own sort of system is.
Thank you. Please explain what the audiology journey should look like through the years. We have had bilateral moderate conductive hearing loss since birth, received a single BAHA at 18 months, and child is currently 2 years and 8 months. Understanding is brilliant, but no clear speech. We use SSE and work with our salt cleft specialist. Currently, we are tested every 6 months. That is more 8 months because of wait times. My daughter is getting wise to the puppet in the corner of the room test. I know she needs her BAHA as she's asked for it, but we are hitting a wall with speech. She mainly misses the first sound of a word, which I know is common with loss. When do we test to see if there is more than just glue ear? She also has PRS. Many thanks.
I think, did you say age 2, I think, with the child? Yeah.
2 years, 8 months.
Right, excellent. Because that is sort of a crossover time between 2 different tests. So you've got the test where you've got the sort of toys at the side, and you make a sound and encourage them to look at the toys when they sort of appear. You get to a certain point, usually around about that sort of 2.5 to 3, where they become quite boring, and then you go on to the next test, but you might not be quite ready for the next test, which is sort of teddies in a bucket and or some a toy in a boat, that sort of test. So it may well be that is the next stage. When they go for their next test, they may go on to that next stage test and be old enough and ready for that. But as far as sort of determining whether it's just glue or whether it's anything else, there's usually a test that you can do with, it's got a band over your ear, the sort of the back, so it bypasses the middle ear. So you'd normally have that sort of test to make sure the underlying hearing is okay. So I would expect probably in one of those tests that they've had previously, they've had that where they've sort of had a look at the actual how the ear is working beyond any glue that's there, just to make sure that there's not actually a sensory neural hearing loss as well. So if there's sort of testing and you've got the BAHA and everything, I would expect it's quite possibly just glue and keeping an eye on the glue, I would have thought.
I'm losing my hearing and worried how this will impact on my job. What support should there be in the workplace for deaf people? I'm sure this differs depending on the job someone has, but I was wondering if there is a standard practice workers' rights that I can discuss with my HR team.
There are quite a few things that you can do. I would say certainly, first of all, go to your audiology department and contact them, because they will have the right list of the right people to contact, and they can refer you or send you in the right direction. So the first port of call would be the audiology department, and also just making sure you've got an up-to-date hearing test, up-to-date hearing aids, everything is optimised for your workplace, and so that they should be able to do that in your audiology department. And then you can go through Access to Work, which is a government website. So you literally just type in Access to Work on your computer, it'll come up with the government link. And that's where you can get a grant to pay for things like British Sign Language, assistive devices in your workplace, support worker if needed. So it's definitely worth sort of looking at the Access to Work website. There's also an NHS England What Works guide as well, which is worth looking up, and that will give you advice for your employer and for yourself as well. And the RNID and RAD, which is Royal Association of the Deaf, which also got lots of assistive devices, advice and links that you can sort of go through as well. So there's quite a few things out there. You just have to know where to go to find it. But definitely your audiology department should definitely know all of those links. But if you go on, look, Access to Work and NHS England What Works guide is definitely a way to go.
Yeah, perhaps I could jump in there as well.
Yeah.
Every employer has a responsibility under the Equality Act of 2010 to provide reasonable changes and reasonable accommodation for any disability. Now, it's interesting to note that hearing loss, you don't need to be registered as hearing disabled. In fact, there isn't a nationwide register of disabilities. So if you have hearing loss, it's your first port of call should be your line manager, and they should be aware of any problems you have in performing your work and should try to accommodate any changes that might be required. And it might be necessary to go to the HR department, and they would work with the Access to Work people from the government. Interesting to note, I was having a discussion with DEFRA just recently about this very issue, and I mentioned Access to Work, and they said, oh, we're civil servants, it doesn't apply to us, which I found absolutely incredible. But Access to Work doesn't apply to civil servants. And the person I was talking to said, if they can't accommodate changes to your position in the office or access to the room, they can just give you another, assign you to a different department, because you're working for the civil service, you're not employed in a particular role more often than not. So that was quite interesting. There is a section on the RNID website which is far better than it used to be, on what to do if you're experience problems at work because of your hearing loss, and it's well worth taking a look at that section because it's a great comfort. When I had a grommet in one ear and a T-tube in the other ear and wore hearing aids, I got a persistent infection, which meant I couldn't wear hearing aids for a time. So my employer sent me somebody to accompany me to meetings so that they could take notes. And when I was doing a presentation, they would take, I could do the presentation okay, but they would take questions from the floor and help me with discussions by writing notes to me and so on. So that's a simple thing. Another simple thing, especially if you've got hearing loss and you rely on lip reading, is position in the office. If you're facing a window, anybody who's standing in front of you has light to their back, and it's very difficult to lip read with somebody in that position. And excuse me, we haven't mentioned lip reading yet, and because mainly we've been talking about children. But it's a very important part of hearing loss. Most people do it instinctively or intuitively, but lip reading classes are a great source of comfort.
I actually went through Access for Work because I have to go on call once every 7 weeks for 24 hours a day for the whole week. And I was wearing my hearing aids all the time so that I could hear the phone ring. And Access for Work meant that my company paid for a device that would wake me up rather than me having hearing aids in all the time and having a lot of ear infections. So Access for Work is a really good tool to use.
Yeah, and it's also important when you're talking to people about your hearing loss to make it clear whether it's a permanent thing, fluctuating, or in fact a progressive thing. Because if it's only temporary, a reasonable change is going to be different, permanent or progressive thing.
Thank you. What support does CLAPA and NHS cleft teams give to parents when a child is diagnosed with a hearing deficit, and how can this be carried on through primary and secondary school?
I mean, I could say and recommend the NDCS. They're extremely supportive and helpful. That's a patients organization, a charity, it's National Deaf Children's Society, and they work really hard in supporting parents for their educational healthcare plan and disability living allowances applications. So certainly I would we have close contacts with them, and definitely I would suggest that people would approach them if there is any issues relating to secondary school adjustments, whether it is the hearing aids, the radio aids, the classroom management, educational input, for example, extra time in exam, taking the exam in quiet rooms. So all of these things can be adjusted for, and helps the child immensely.
You've also got your audiology department will, if you have a hearing aid, you'll be sort of there sort of fairly often, usually sort of 3, 6, 9 months. You'll be sort of followed up just to make sure everything is okay with your hearing aid. And also you have a teacher of the deaf, which is a sort of like a support worker who goes around different schools and makes sure everything's in a similar way to the NDCS. They'll go round and make sure everything's okay in your classroom. They'll have they'll liaise with your teacher and the audiologist as well, so they're sort of like quite a close team, and just sort of making sure that everything is working as well as it can be for you. So if you've got a cleft audiologist in your sort of cleft team, then they will also liaise with your local audiology department. So things like assessments that you have will be sent to the cleft audiologist, so we can keep an eye on everything. So we liaise with the audiology department as well. But if you have got a hearing aid, then yes, a teacher of the deaf will sort of follow you right through to university. Really, it sort of goes on for quite a while, and you'll be part of the paediatric audiology team until the point you're out of education. So that will be at the end of university if you go that far as well. So it's quite a long time that you'll be under their care.
And teachers of the deaf are a fabulous resource, I have to say, and you know, that is funded by either the local authority or the NHS, publicly funded in any case, so it's not something you pay for privately, but the teacher of the deaf visits the child in the schools, so they see how they're managing with their hearing in that environment and in that kind of listening environment, we call it, but they also potentially, if the child needs it, might be able to offer or at least discuss with you some additional technology. So there are things called radio aids. So the teacher has like a microphone box, and there's often a little plug-in that plugs into the bottom of the child's hearing aid. And so that means that the child can directly hear the teacher, and it cuts out a lot of the background noise that is in classrooms. Often the child next to you tapping a pen on the table, for example, can be really distracting with a hearing aid. So I do think the teachers of the deaf often offer a fantastic service. I think funding, like most things, is variable, and funding for technology can also be variable. But certainly if your child has a hearing aid, there should be some form of teacher of the deaf involvement. So that's certainly something to ask about at your audiology appointments if you don't have it already.
I think it's sort of, it should be part of every department, hopefully. I would think that they've got a teacher of the deaf there, and they also see them before they go to school, so right from birth. So they're a teacher of the deaf, but it's a sort of strange name really, because they don't go in and teach as such, but they support you all the way through. So right from when you're born till I come into your home and sort of discuss everything with you, help you through the process. So yeah, brilliant.
They can also troubleshoot hearing aids and things sometimes. So if you've got lots of whistling going on, or you've got a blocked ear mold, whatever it is, I think they're fantastic. So certainly that's something to look into if you haven't got it in place.
Thank you. Next question is, I had T-tubes fitted 10 years ago. They advised that these are semi-permanent. At which point should I look to be making the transition to hearing aids? I am considering this option, but not sure who or where to get these from.
Okay, so it's slightly, so there is two parts to this question. If there is a hearing impairment regardless of having a T-tube in the ears and the drum, then definitely a hearing aid should be considered, or other interventions by the ENT surgeon. So it really depends. If there is an impairment that needs to be addressed, and because otherwise there'll be significant amount of missed opportunity. Then regarding the T-tubes, we don't, I mean, at least in our current practice, it's not commonly used as much as, say, few years back, 20 years back or so. So if it's not producing the function which it's meant to be, and the child is much older and the risks of blue ear are much less, then the person probably need to go and have a discussion with their audiologist and say, well, should we remove them? Should, especially if they're producing, in my experience, they tend to cause lots of infections, and they will not just infections, but they will erode the drum, so you end up with a permanent perforation. So I think definitely a discussion with the ENT surgeon to see whether are they still producing the purpose which they were fitted originally for, or they're now just not functioning and need to be removed. So I think that's an important consultation to have, and address the hearing loss if the hearing loss is still present.
if there is a hearing loss there, and sort of whether the teachers are sort of working or out, etc., but there's a hearing loss that the ear, nose and throat specialist feels that a hearing aid would be suitable, they should be referring you to the audiology, their local audiology department. So that is quite an easy progression from ENT to the audiology department, because they're usually within the same sort of team. So they'll refer you to audiology, who will then sort of discuss all the things that they've got and what would be suitable for you.
Yeah, I mean, my experience with T-tubes wasn't brilliant. I had quite a few ear infections while I had a T-tube, and when it was removed, I had a permanent perforation. When that was repaired, I lost an awful lot of hearing in that ear.
Myself and my daughter have hearing loss, so we are learning British Sign Language at the moment. Can you recommend any particular resources we can use to improve our sign skills? And are there any good national face-to-face meetups where we can meet others to practice?
The sign language lady might be the person who actually knows sort of quite a lot about this one, I think. But I've sort of noted down there's a few. There's the NDCS British Sign Language. If you look up the NDCS, they will have British Sign Language classes and information on that. There's also a website, britishsign.co.uk, which is sign language classes, sort of advice courses and things like that as well. I haven't seen on these there's anywhere that you can meet up and practice with other people, which I think is a fabulous idea, but I haven't noted that. But it could be, if you go onto the website, chat to them, that they will have something like that. So it's definitely worth going on to the NDCS and the British Sign .co.uk and seeing what they can offer, because there's a lot out there. I think you just have to get advice from the people who are doing it.
The only meetup group that I could find was in, I think it was Bristol, but I'm sure there are some around. Perhaps lip reading classes might know of other meetup groups which use sign language.
Did you want me to add something as the interpreter? So if you're looking at more information, maybe you could look at the awarding body called Signature. And I think you put in your postcode and that will bring up courses in your area. And then have a look at deaf clubs. Just Google or whatever search engine you use, put in deaf clubs for your area, and that should list the meetups. But most places at the moment are meeting up in pubs, and that may not be appropriate if you're talking children, but it may include children, but have a look at that. But also NDCS will provide meetups too.
Sorry, Julie, you froze slightly. Did you say Signature?
Yes, so Signature, SIGNATURE, are the awarding body for the qualifications for sign language. So if you look on there, that will show you sign courses, but also, as I say, deaf clubs might be a way through. Also, some schools maybe have a club that you can go to. Yeah, and NDCS definitely do have regular meetups. Is that okay?
That's great, thank you. I'm aware we're slightly over. I think we've only got one more question, if everybody is okay to carry on to that. So what are the best technologies out there for someone who is hearing impaired?
Hearing aid, oh, sorry. Don't know who was saying that there. Hearing aid wise, all the hearing aids on the NHS are digital and have been for quite a while, so the technology inside is pretty good. But now most departments, I would think now, are fitting Bluetooth hearing aids, so might not be all departments, but certainly a lot of them. And speaking for my department, we're fitting the Bluetooth ones that you can link up with your phone, your mobile phone, stream through things through your phone, which is really useful, and people are really finding that very helpful. You can also get assistive devices, so you can get things like your own loop system, but also your own sort of streamers where you can attach sort of to your telephone, to your television, and have things coming directly through your hearing aids. Things like your own personal streamers where people can talk in, a little bit like a radio aid, where people can talk into that, and so it goes directly into your hearing aid. So there are a lot of assistive devices, and I think, Brent, you're the person to talk about this, because it's the RNID do lots of assistive devices, so I think you're probably the next one to talk.
Yeah, I've got a Roger pen here.
Lovely, yeah.
Which is really very useful, and that's only for my demonstration, but this is the microphone that I use. Find it very useful. My wife wears it in the car, and we can actually have a decent conversation. And I give it to any instructor or lecturer that I go to. My dance instructor wears it for us. Yeah, after hearing aids, the first thing I looked at was alerting devices for the home. So I knew when the doorbell was ringing, or the phone was going, or the smoke alarm was going off, or potentially when the baby was crying. There are many makes out there. There's some links on the RNID website to Conovan's, which is all things to do with hearing loss. But actually the most exciting thing is a no-cost item, and that's speech-to-text apps, which are becoming much more better of recent years. I use two. There's one which records the voice and gives you an immediate transcription, which is then revised for your permanent collection, if you like. I use that especially for when I'm going to the doctors and want to keep everything he's said. And the other one is for my phone, speech to text coming up while I'm on the phone. I can see what the other person is saying, and that's a no-cost item as well. It's just an app. So microphones, alerting devices, and speech to text, I think they're the affordable things.
Thank you. I'm afraid that's all we have time for tonight. If you've enjoyed the event this evening and would like to share your feedback, this would be incredibly helpful. A link to the feedback form will be added to the chat feature here on Facebook. Thank you for taking the time to do this. Not only does it help to improve these events, but it also really supports us when we apply for future funding as a charity. Thank you so much to Colette, Ralph, Amy and Brent for giving up their time to talk to us. It's hugely appreciated, and I'm sure everyone watching feels the same way. Huge thank you to Julie for interpreting using British Sign Language this evening, and a big thank you to CLAPA volunteer Jen.
Thank you.
Oh, you're muted, Jen.
Oh, so sorry. My mistake. Sorry, I should say huge thank you to Lisa as well. Thank you to everyone who's joined us online tonight. This video will be available on CLAPA's Facebook page straight away, and a subtitled version will be posted on the CLAPA website as soon as possible. If we didn't get round to answering your questions in the chat, remember you can get in touch anytime at info@clapa.com, where CLAPA staff can help point you in the right direction. We hope you've enjoyed the Q&A and that we'll see you again at one of our upcoming online events in the future. So from all of us, good night and have a lovely rest of the week. Thanks very much.